Hi folks, it's Thursday evening, April 23rd, the day after Earth Day. Mayor Gearity coming to you today live with an update on some of the latest numbers and some of the testing results that we're getting back both locally and statewide. Our number of positive cases in the village of Ossining today is 706. And that number is concerning. And so I've heard from some community members who are very concerned that Ossining's numbers seem to be higher proportionately than so many other communities in Westchester. And so I've reached out to both Dr. Ambler, who's the head of the County Department of Health, as well as Lindsay Farrell, who is the head of the Open Door, which has its headquarters here in Ossining, though it does have locations in other parts of the county. So far, I've heard back from Lindsay Farrell, again, she came to our meeting at the first of the month, and you may have seen that. I've certainly referred to it a few times. And what she did today was reaffirm the position that she gave us then, which is generally we all know that this virus is spread by close contact. So when you are in communities where there are many people living in close quarters or in a densely populated community, then yes, it does spread more, which is why you see high rates in New York City, where people live in close quarters and in buildings next to each other and in densely populated neighborhoods. We are a small village, but we are a densely populated village. So it's not surprising that we have high rates of positive cases. The other big reason why we have high rates of positive cases is because we have a lot of testing. And from a healthcare perspective, that's really good news, because that means they are identifying, the Open Door is speaking with its patients and identifying people who have had contact with someone who has a positive case, who has symptoms, and they're getting tested. And when they get tested, that means they get the information that they need to reduce the likelihood that they're going to spread it to other people. And that's critically important. Getting education, getting the healthcare information to people who test positive is critically important. So we're glad that there's a high rate of testing. Portchester has a similarly high rate of testing. They're a village that's a little larger than us, and they also have slightly more cases. As of today, they have 771. We have 706. They have I think they have about 3,000 more residents as of the last census than we do. So that's a similar proportion. And part of the reason for that, my understanding now from hearing from Lindsay Farrell today, is because just like in Ossining and Portchester, they started testing very early on. So they have a number of weeks of testing results that are contributing to the numbers. So while it is frightening for us as people who live here to see the number so high, the reality is that is largely a reflection of the high rate of testing that's happening, not just the high rate of infection. And testing is a question or a topic that is very much on the minds of everyone who is looking to figure out how can we reopen and what will that look like. And this week, New York State started doing some immunity testing, and that early results of that Governor Cuomo just came back with today, which is about 14% immunity widely. That said, there are a lot of caveats to this study so far. This was random testing. It was random testing of no children, so only people over 18, only people who were not staying at home, so people who were out in the world. So that would mean anyone who is sick with symptoms would not have been included in that. It also means anyone who is in an institution like a nursing home or a hospital or some care facility would not have been included in the random testing. And also people who are very likely to be exposed because of their greater contact with the world is people who are our essential workers. And so if people were working, then they also were not included in the random sampling. So random in this case actually had a fair number of groups left out. So but the early results are about 14% have the immunity. So we'll see how those numbers continue to evolve. It's going to be critically important for us to understand the immunity rates as we look to be able to open up schools and businesses and not just open them, but to be in an environment where people feel safe enough to go out and be in a group setting and to send their children to school, and being able to know the immunity rate, to be able to know ideally that there'll be some treatment coming along soon that is more widespread is all really important things for us. I will just say the one other resource that I reached out to that I haven't heard back from yet is Dr. Ambler, Dr. Ambler is the head of our county Department of Health. As I updated folks yesterday, Senator Gillibrand was part of our county call yesterday. Dr. Ambler will be part of a countywide call, I believe it's tomorrow. And so I've sent her a question, similar questions to what I sent to Lindsay Farrell, but asking her for any insights she can provide us to a broader understanding of how much is being testing is being done in the whole county versus how much testing is being done in Ossining, so we can really better understand why we seem to have such a high infection rate. Is it really just a function of having more testing done? In conjunction with the fact that we are a denser population, then Pound Ridge is always going to have a lower rate of infection because people live in large properties and not so close to their neighbors. So there's not as great a likelihood of being able to infect someone. But beyond that, it is concerning, and it's something that we're paying attention to, and we want to make sure that we understand so we know if there's anything more we can be doing from a community perspective. And that was my other question to Lindsay Farrell and to Dr. Ambler. What can we be doing as a community to help reduce the spread and keep our community safe? So I hope that you are helping with that effort by staying at home. And when you do go out, if you're going to be in close contact with people, that you're wearing a face covering, and that whenever and wherever you are, you're washing your hands and you're doing it thoroughly. And if you are someone who is in a high-risk group, you really, really should not be going out, if at all possible. And there are so many people in this community who have volunteered to help bring groceries and bring meals to people and do errands for people. So I very much hope that everyone is finding the help that they need. If you are looking for more resources, the Village sends out a web blast every Thursday, which I strongly encourage you to sign up for. Sometimes we link it on the Village of Ossining Facebook page, but you can sign up, subscribe to that email at thevillageofossining.org. Okay, I think that'll be it for tonight. If I get any insights from Dr. Ambler tomorrow during our countywide call, I will definitely include them in my Friday update. I hope you all are safe at home. Be well.